Depression. 1 in 5 girls become pregnant by age 18 in sub-Saharan Africa. Adolescents are up to 9 times more likely to develop prenatal depression. More than 50% of adolescent mothers have depressive symptoms in their first year of postpartum. By 2030, there will be an estimated 16.4 million adolescent mothers in sub-Saharan Africa who will raise millions of more children. These adolescent girls' families and communities are the future of our world. We must therefore prioritize their needs by providing and promoting the following: access to information about their physical and mental health, screening and early identification of prenatal mental health disorders, increased care and support from family, peers, healthcare workers, and social workers, teaching adolescents life skills to manage their life's challenges. Their lives depend on such focused social actions, and our socio-economic growth depends on youth empowerment. This tragedy is being experienced here in Kenya, presented to you in a fictional story by Beatrice that she narrates next.
My name is Beatrice and I'm 15 years old. I live in an informal settlement of Nairobi, Kenya with my mother and 2 sisters. My mother works as a house help. Life became hard when my dad died. My mother got married to a man, an alcoholic, who hardly supported us and always quarreled with my mom. Soon he left us on our own again. I'm in Form 2 and I dream to become a fashion designer one day. My best friend is called Julie, an outgoing girl. We go to school and do most things together. I can talk to her about anything. One day, Julie invited me to a club. So we snuck out to enjoy ourselves. It was so much fun. There was nice music, smart people all around, and we had great time dancing. That night, I saw a very stylish man. He kept smiling and looking at me and introduced himself as Charlie. He asked for my phone number, but I had no phone. We, however, managed to meet the following weekend where he invited me at his house. And as he was driving me off, he surprised me with a phone, kissed and touched my thigh. We had been spending intimate time with Charlie, and after 2 months, he started avoiding me. I started noticing body aches, a stiff stomach, and was often nauseous. I also noticed that my belly was slightly protruding. My breasts hurt when I touched them, and I was so scared. He must have hated me because I was getting bigger and wasn't the same girl he first met. I hated the way I looked too. My mother had noticed the changes and told me I was pregnant. She started shouting and beating me, saying how I was bringing shame to the family. I felt ashamed. I stopped going to school and avoided Julie due to shame. One day, Julie came to see me. She said she knew a nurse who would help me at the health center. I didn't want to go, but she went with me. I was required to do an ultrasound, so I had to sell my phone to get the money. We then met Nurse Martha, who gave me information about pregnancy, diet, and self-care. I kept coming back to the health center to see her, and she would help me and the baby be well. She noticed I was stressed and later introduced me to Anne, who was a community health worker. Anne proceeded to introduce me to a group of age mates who were either pregnant or given birth, going through similar problems in their lives. She told us we had depression. Through the group, which held weekly structured sessions with guidance of a community health worker and a nurse, we were guided through a program where we met once weekly for 8 weeks, with a focus of each meeting based on 4 main categories called phases. That is, pre-group phase, initial phase, middle phase, termination phase. In the pre-group phase, we were individually taken through assessment to score our depression level. My depression level was a 27/30, which indicated that I was severely depressed. The facilitator helped me to understand the link between interpersonal challenges I had and the depressive symptoms I showed, and that it was okay to feel the way I feel. She told me that according to the method of talk therapy called interpersonal psychotherapy, my interpersonal challenge were grief and loss and life changes. She told me that depression was treatable using talk therapy or medicine to reduce the symptoms. In the initial phase, which is considered as session 1, we were grouped together as either pregnant or breastfeeding young adolescents who all had been assessed and seemed to have similarities of symptoms of depression, with emphasis of only 8 weeks of the program. Each one of us shared the experiences in a group format as guided by the facilitator. Our different issues were picked, 1 or 2, all linked to depression signs each one of us felt. We were taught coping methods for each problem one faced, including coping with grief and loss, communication skills, social skills, problem solving, and livelihood skills. We practiced the method in session for mastery. We had homework on a specific issue to resolve back at home. In the middle phase, which was called session 2, all the way to session 7, a period of 6 weeks, we always were guided by our facilitator to share how our previous week went. Each one of us shared their week activities and how they felt, good or bad, and why. Again, the different stories brought out different issues that were captured and linked to depression signs each one of us felt. Learning and practicing of coping skills continued even outside the session, in preparation for termination and ability to do well with our facilitators outside the session. Finally, the termination phase, which was called session 8, which mainly focused on reassessment of current depression, where mine was captured at 4/30, as I was struggling with what I wanted to do after session and giving birth. I wanted a job or money to go back to school. My participation in this group had improved my relationship with my mother, Julie, and my sibling. However, some of my friends were scoring 8/30 and needed further care, so were referred for assistance. We mastered skills in case depression symptoms developed, and also kept the facilitator's contact and group members for peer support. After completing 8 sessions, I was linked to a community-based organization where I learned business skills and tailoring. It has been months now and the business is growing. I'm able to cater for both me and my baby's needs. I also assist my mother with house bills and saving some money to go and finish my secondary education. Thank you, Inspire Project, for empowering me and my friends. I am an empowered and inspired youth, energized to live life joyfully.